Get it into my hands, and then what I do is I cup my hands in the back, and I start cupped in the low back, and I move towards the upper back and towards the head. And as I move up, and I feel like the lotion has been distributed, I can flatten out my hand, and I get more lotion that way onto the upper portion of the body, and it's a little bit smoother, and I don't have to reapply lotion as I'm moving upward. If I don't have enough on the whole body, I can always get more now. But that feels nicer to the body than if you just apply it on the low back a little bit and on the upper back a little bit. One of the things that's very, very important when we work with a body, we want to make that body feel as comfortable as possible. One way we can do that is by having a hand on their back. So contact is very important. If I do things up here and Rob's face down and he cannot see what I'm doing, he starts wondering, what the heck is he doing at some point? Not that that's a problem, but it does decrease the unconscious trust a little bit. Okay? So I apply the lotion, I move up with broad strokes, I keep my fingers a little bit separated and spread out versus doing it like this. This is the reason for that is the body has sensors that pick up touch, and in the back the distribution of those receptors is not that dense. That means Rob cannot necessarily distinguish between this point and this point that there's two different points. In the thumb he can completely distinguish that because the concentration is much, much greater there. So because of that, having the fingers a bit broad gives the sense of a broader stroke versus a narrower stroke, and that feels less good, generally speaking. So as I'm doing these main motions, and I apply a little bit more lotion now because he's absorbed some of it, which is fine, that's just the way it is. He's thankful for that, his skin is thankful for that. So as I'm doing that, I'm feeling. What am I feeling? I'm feeling muscle tightness. I'm trying to think that these muscles, they might be just fine, but some of them might be really hurt. And I approach them like they're little children. And that way, I come at them with a little child that's crying. How do I approach that little child? I'm not just giving a little child command. First I want to figure out what has happened to that child. So if I approach a muscle in the back that way, I'm definitely going to be careful enough. So that's why I like to do that. I feel the tension. I can take his back and I can move it around a little bit from side to side, and I can feel, where is there tension? I can look. How is the body moving? Like here with him, when I move from side to side, holding the pelvis, I can see I get some movement right in here. That's all right. But then, like right here, it sort of stops. It doesn't really give me the same amount of movement. The whole back moves a little bit as a unit, and I know if I were doing this for quite a while, it would start unwinding, and it would start feeling a little bit looser. Okay? But now I already picked up, there's a bunch of tension in here. And I can also see that when I just look at it. We'll get another example on the table afterwards, and we'll see if that's different. I also want to compare which side feels different than the other side. Which side is more tense? Right now on Rob is fairly balanced, but the right is still a little bit more tense than the left. That's his normal pattern is the right side is a little more tense. And you do get, very often one person has one side be the dominant side, and so that side usually is a little bit tenser to do more things with that side. There's also more muscle on that side. Alright, so I can do a few ways of stroking the broad strokes. I can do the regular pressure on all the hands and all the fingers throughout. Or I can go and I take my thumbs and I put my pressure on my thumbs. I'm a little bit more pointed that way. So I can do that after a few of the broad strokes. And I can just sort of go up and down the spine on both sides. And I start noticing cables in there. So there's, generally speaking, there's two tight cables going up and down the spine. And I want to feel, how does a cable feel? Is it thick? Is it thin? Is it total steel, or does it give a little bit? So I can go across the cable. Not too much pressure because that might be a little bit tender. And right here, it jumps. You see that jump? That's his cable jumping. The cable feels like it's about a centimeter thick. And I jump over it. On this side, it's a little thinner. It's not as thick. Okay, so that gives me good information because I want to work with that cable. That cable is where a lot of the tension is harbored. A lot of the trigger points are harbored in that cable. Okay, so that's a way of making a stroke with the thumbs. I can do it with my fingers, also fairly pointy. I can put more pressure onto my palms right here, and I can get a fairly strong motion going upward. And one of the things I want you to pay attention to is how I move with my body. Now, my body mechanics might not be that great, depending on, but I picked up a few good habits along the way. One of the habits is, I'm not pushing from here. I'm not pushing from this end. I keep this end stiff. It's very muscular, it's very strong, and I need it very strong, but I don't want to do this. So I don't want to have it be a force. I can use my whole body weight and be more of a it being more of a passive force by just lowering my body weight more and keeping this stiff, and I can lean into it that way. And that gives the patient more of a feeling of I am relaxed. Because if I'm pushing against them and they're right here, they're not feeling me relaxed. But if I'm just leaning into it, they're feeling me relaxed. And that is very important for their sensation. Okay? So when I move this way, you see I'm moving from here. I'm not moving from my arms. Okay? Another way of working it is I can take my fists, and I often go behind the body. This table's a little bit tall for me, even though it's short for a massage therapist, but I often go like this, and I take my thumb, not my thumbs, my fists, and I just squeeze that cable up all the way. Up here I need to be a little bit sensitive because I got a bunch of bones. Right here I got a bone. It's the scapula, the shoulder blade, here's the spine, and then right here are the ribs. So the ribs, depending on how they are, can be somewhat tender, okay? So we want to make sure we're sensitive to that. Direct pressure on the bone can be a little tender. I can check in with my patients, which is actually a good thing because you want to develop your senses. You don't want to ask them every second, is this enough pressure, is this good? But once in a while is important, especially in the beginning. Because if it's not too often, it gives the patient a sense that you're checked in with them, versus if it's too often, they start asking, does he know what he's doing? So you got to be a little sensitive about that. So I can come all the way up. And my contraction right now is actually my leg to really get the right angle. And then I can all the way down. Usually up in the midline. Go up to the neck. A little bit out, because up here we have the trapezius. And then down on the outside. That's a very good way of sort of doing that. Okay? So why don't you come here?